Good morning, everyone. I'm excited to welcome you to today's presentation. Today, we'll be exploring Ephedra, ancient medicine, modern challenges. We'll look at its historical roots in Chinese medicine, how it's used in today's pharmaceuticals, and the controversies surrounding it. So, let's dive in and discover the fascinating journey of this powerful plant. Let's take a moment to get to know the Ephedra family. First, we have Ma Huang, which is the traditional Chinese name for Ephedra sinica. This species is particularly important because it contains powerful alkaloids that have been used medicinally for centuries. Moving on, you'll hear about desert tea, also known as Mormon tea or Teamster's tea. These names reflect its historical use across different cultures, highlighting its significance beyond just traditional Chinese medicine. Lastly, the Ephedra family isn't just about one species. There are multiple, including E. gerardiana, E. intermedia, and E. equisetina. Each of these species offers different alkaloid profiles, which means they can have varying effects and uses. Overall, understanding this diversity helps us appreciate the complexity and potential of the Ephedra family in both historical and modern contexts. Let's take a closer look at the global distribution of Ephedra species. In China and Mongolia, Ephedra sinica thrives in these regions and is actually the primary source for traditional Chinese medicine. It's been used for centuries in these cultures, highlighting its importance. Moving over to the Himalayas, you'll find Ephedra gerardiana growing across high-altitude areas in India, Nepal, and Pakistan. These mountainous regions provide the perfect environment for this species to flourish. Lastly, in the American Southwest, there's Ephedra nevadensis, which is found in Nevada, Utah, and Arizona. Interestingly, this species contains very low levels of alkaloids compared to others. Understanding these regional differences is key because they influence how these plants are used medicinally and their alkaloid content. This distribution ties into the overall theme of how geography shapes the properties and uses of Ephedra species worldwide. When we look at the chemical powerhouse of this plant, we see it's rich in primary alkaloids, which are the key active compounds. The most well-known is ephedrine, which is primarily responsible for many of the plant's effects. Then there's pseudoephedrine, which is widely used as a decongestant, helping to clear nasal passages. We also have norphedrine, which acts as a stimulant in the central nervous system, and methylphedrine, which supports the overall alkaloid profile. It's important to note that the alkaloid content can vary quite a bit, anywhere from 0.3% up to 3% of the dry weight, depending on the species and growing conditions. This variability influences the potency and the effects of the plant. Beyond these primary alkaloids, the plant contains supporting compounds that contribute to its overall properties. Tannins, for example, give it astringent qualities, which can be useful for certain medicinal purposes. Flavonoids act as antioxidants, helping to protect cells from damage. The volatile oils are responsible for the characteristic aroma, making the plant not only potent but also aromatic. And there's resinous matter, which adds to the complexity of its chemical profile. All of these components together explain why this plant has been valued historically, not just for its active alkaloids, but also for its supporting compounds that enhance its overall therapeutic profile. Let's start by looking at how we identify substances in the lab. First, we have color tests, which are quick and straightforward. For example, Dragendorf's test produces an orange-red precipitate, and Mayer's reagent creates a white precipitate. These reactions help confirm the presence of alkaloids, which are a key class of compounds we're interested in. Moving on to chromatography, specifically thin-layer chromatography or TLC. By using a solvent system like chloroform, methanol, and ammonia in a 90:10:1 ratio, we can separate the different alkaloid compounds. When we look at the results under UV light, the pattern of spots tells us a lot about the alkaloids present in the sample. Finally, for more precise identification and quantification, we turn to advanced techniques like high-performance liquid chromatography, HPLC, and gas chromatography mass spectrometry, GCMS. These methods give us detailed information about the specific compounds, such as ephedrine, and help ensure accurate analysis. All these techniques together form a comprehensive approach to identifying and analyzing substances in the lab. which is crucial for our overall research and safety assessments. Let's now explore some of the key therapeutic applications of this substance. First, it's a powerful bronchodilator, which means it can open up the airways effectively. This makes it particularly useful in treating respiratory conditions like asthma and bronchitis, providing relief by easing breathing. Next, it acts as a decongestant. By constricting blood vessels in the nasal and sinus areas, it helps clear congestion, making it easier to breathe through the nose when you're stuffy. It also functions as a CNS stimulant. This means it can increase alertness and help combat fatigue by activating the nervous system, which is why it's sometimes used to stay awake and alert. Additionally, it can raise blood pressure in cases where someone is hypotensive, supporting cardiovascular function during those times. However, it's important to remember that the use of this substance is highly regulated. Its potential for adverse effects and abuse makes it necessary to monitor and control its use carefully. Overall, these applications highlight its versatility, but also the need for cautious, regulated use in medical practice. Let's take a closer look at some traditional medicine systems. Traditional Chinese medicine, for example, has used Ma Huang for over 2,000 years. It's been valued for its ability to treat respiratory conditions and to promote sweating, which helps in fever reduction and detoxification. Moving over to Ayurveda and Unani, we see similar therapeutic uses with the plant Ephedra gerardiana. These ancient healing systems have long recognized its benefits. Interestingly, in Sanskrit texts, this plant is referred to as soma, highlighting its sacred and medicinal significance in those cultures. Overall, these traditional systems show a rich history of using natural substances like Ma Huang and Ephedra to support health, connecting to our broader theme of understanding how different cultures have harnessed nature's remedies throughout history. Let's take a look at the current market products containing ephedrine and related compounds. First, we have Bruncud Rujustarid, which combines ephedrine with guaifenesin. It's available over the counter, but it's sold in limited quantities, mainly due to safety concerns. Next is Pramatun Rujustarid, which uses ephedrine sulfate tablets and is regulated in the U.S. to ensure proper usage and safety. We also see the use of Ma Huang extracts, which are herbal products derived from traditional sources. These are often subject to bans because of their potent effects and safety issues. Then, there are TCM formulas. These are licensed blends used in traditional Chinese medicine, often under the supervision of practitioners. An important point to note is that many energy drinks and weight loss supplements previously contained ephedra, but due to safety risks, most countries have now banned these products. This highlights how regulatory changes and safety concerns have significantly shaped the current market landscape for ephedra-related products. Let's take a look at the regulatory landscape across different regions. Starting with the USA, the FDA has banned this substance in dietary supplements since 2004. The main reasons are concerns over cardiovascular risks and overall safety. It's a clear example of how safety concerns can lead to strict regulations. Moving to the European Union, the substance is prohibited in over-the-counter products. However, it is still strictly controlled when used as a pharmaceutical, highlighting the different levels of regulation depending on the context. In India, it's controlled under the NDPS Act as a precursor chemical, mainly because of its potential use in methamphetamine synthesis. This shows how regulations also target preventing illegal drug production. Lastly, in Australia, it's classified as a Schedule 4 drug, which means it requires a prescription. This reflects a serious regulatory oversight, emphasizing the importance of controlled access. Overall, these regulations across regions underscore the significant health and safety concerns associated with this substance and the global effort to regulate its use. Despite the restrictions surrounding ephedrine, it still holds a significant place in the pharmaceutical market, particularly for applications like hospital vasopressors and bronchodilators. This shows that, even with challenges, its medical value remains strong. Researchers are also exploring safer analogs to improve its profile and expand its use. China continues to be the leading producer, supplying the global pharmaceutical industry's needs. Looking ahead, scientists are focusing on developing semi-synthetic derivatives and safer therapeutic options, as well as controlled-release formulations to optimize delivery and safety. Meanwhile, pseudoephedrine remains widely used in cold and flu medications, highlighting its ongoing importance in everyday healthcare. All these points tie back to the overall theme of innovation and adaptation in this industry, balancing regulatory challenges with the ongoing demand for effective medical solutions.